Everyone. Dr. Desai here. I wanted to do a quick follow-up on intubation success video that I just did yesterday. I talked a lot about PEEP and the benefits of PEEP, but we need to remember that sometimes too much of a good thing is also not good, right? It can cause some problems. So I just kind of wanted to go through some finer nuances of when you're using the PEEP and things to kind of consider when you're bagging a patient, you're using the BVM, or just anytime you're trying to ventilate a patient. So just a quick couple of points here. First thing, remember that the BVM, the ambu bag that we use, it has a volume of just under 1,500 milliliters. Normal tidal volume in an average adult is about 600, 700 milliliters. So you don't need to try to squeeze the entire contents of the bag when you're using the BVM to ventilate the patient. You just want to squeeze enough to see chest rise and fall. That's how you know you're getting enough air into the lungs and you're getting proper ventilation. So keep that in mind. You don't have to try to squeeze the entire bag to get the entire contents, because you're giving them twice as much volume what they really need. The second thing, when you're using PEEP, you saw how it recruits the lung and keeps it inflated and open. That's a part of it that you may not need as much tidal volume per breath as you normally would, because now you got positive pressure in the airways. The lungs are staying a lot more inflated. You don't need to push as much air in there as you may on a completely collapsed lung. So just remember that. When you bag too aggressively, you can potentially end up causing barotrauma and causing pneumothorax. So you want to be really careful about overbagging, and then adding the PEEP valve. That's even more likely. If you've got the PEEP valve on, you're pumping a lot of air into the lungs. What happens when you put too much air into a balloon? It pops. The lungs are similar, so be mindful of that. Just don't bag over aggressively. The PEEP valve makes bagging a whole lot easier, and it makes your bag ventilations a lot more effective. So keep that in mind. You don't have to squeeze that entire bag. If you have just the bag on the patient, you're just trying to give them some oxygen, patient is awake and spontaneously breathing, don't seal that mask on there so tightly that when they're trying to exhale out, they can't exhale out. Just keep that in mind. Give them a little bit of space to breathe out when they're exhaling, because I don't know if you guys have ever put the BVM on yourselves and tried it. It can be a little bit suffocating, even though it's meant to help. So keep that in mind, okay? When using the PEEP valve, also remember, in asthmatics and patients with COPD, be extra careful not to bag too rapidly and with too much tidal volume, or you're going to cause air trapping in their lungs, and you can cause a pneumothorax very easily in these patients. You don't want to give these patients too much PEEP either. Usually maybe a PEEP of 5 will help them tremendously, but if you increase it too much, they're already, in asthmatics, they're already having trouble exhaling because their airways are inflamed and narrowed down, right? Same thing with COPDers. They don't have the elasticity to their lungs, so when they try to exhale, their lungs don't deflate as efficiently as a normal lung does. So they're gonna stack air, they're going to trap air in their lungs, and when you add that PEEP in there, it can potentially worsen it. So you don't want to go too high PEEP on these folks. Stick to 5. If you need to, be very careful about increasing it. In your congestive heart failure and your pulmonary edema patients, if they don't have lung disease like asthma or COPD, on these folks you can go up to 10. And even in a normal lung, if you're just having problems opening up and ventilating them, you can go up to a PEEP of 10, and that'll really help ventilate some of that closed off lung. So keep that in mind. On your asthmatic COPDers, be really careful how much PEEP you give them. PEEP of 5 is probably going to be more than what they need. In your CHF pulmonary edema, PEEP of 10, you probably will be okay with that. And another thing to keep in mind is, when you have a hypotensive patient, just remember, when you're bagging them and you have the PEEP valve on, you are increasing the pressure in the thoracic cavity, and that extra PEEP is going to cause decreased return to the heart, and it's going to worsen that hypotension or that right ventricular heart failure. Remember the physiology that I talked about in one of the previous videos. So make sure when you have these people, make sure you're fixing the physiology if they're hypotensive or whatever, and just be mindful. If you got a hypotensive patient and you put PEEP on them and you're bagging them, and now, oh my God, their blood pressure is tanking on you. Okay, you know why. Back off a little bit on the PEEP. Let the patient's lungs exhale and get all that pressure and air out of there, and you might see your blood pressure improve. So just keep that in mind. Just some tips to follow up on. That way we don't over aggressively treat someone with PEEP. Everything has its nuances. You want to be careful with it. That's medicine, but hopefully as the more we learn, the better we'll get at it. Any questions or comments, please comment below or come see me. I'll talk to you soon. Bye-bye.